Hello and welcome. We're going to start the webinar in 1 minute to allow everyone to enter the meeting from the lobby. Good afternoon. My name is Chris Rowena, Communications Analyst at Health Workforce Development, and we are excited that you have joined us today for the Golden State Social Opportunities Program webinar. Before we begin, I would like to discuss a few housekeeping items. The webinar will be recorded and posted on our website in approximately 7 to 10 business days. The chat option will be open during our Q&A session, which is at the end of this webinar. At that time, feel free to place questions in the chat. The slide deck will be posted on our website and a link can be found in the chat box now. We want to take a quick minute to take a poll to see who our audience is. Results are anonymous and please fill that out now. And today, as we get started, we have a special video introduction from Assemblymember Reyes, the sponsor of the bill that created this program. Let's go ahead and watch that now. All right, and a big thank you to Assemblymember Reyes for the video introduction. And with that, I'm thrilled to introduce our first presenter, Karen Reisel, Deputy Director at Health Workforce Development.
Thank you, Chris. And thank you everyone for joining us here today as we get to share information about this new program as Assemblymember Reyes shared her vision for this program. And so we are looking forward to offering it and want to take some time today to present information about the program, a little bit about HCI, and answer all of your questions. So go ahead and move to the next slide. So as you heard the introduction about the program, and we'll kind of dig into that with more details, I wanted to share a little bit about the work that we do at HCI to support the increase of the health workforce in California. So on the next slide is just, HCI, which formerly OSHPD, you'll see in a future slide, who was renamed HCI, Department of Healthcare Access and Information, in 2021, really to solidify our mission and vision to expand equitable access to quality, affordable healthcare for all Californians. And as you see at the bottom, through the health workforce each community needs. As Assemblymember Reyes said, the importance of really building the workforce to serve the California that we represent. On the next slide is just again, so you will see in this slide, I wanted to share about what we do in our programs. So the focus of our work at HCI in our health workforce programs really are three things. We want to support and increase and build a health workforce that serves in those underserved areas in California. We know there are many areas where there are shortages of behavioral health professionals, of primary care providers, of all types of professionals. So our programs serve to increase the spread of providers throughout our state, but also to represent the California it serves through racial and language diversity. California is a diverse state. We need a diverse health workforce to support that. And also be able to serve those in need throughout our state and be able to serve Medi-Cal members. Our programs to do that, we have three main areas of programs. One is our programs to organizations to be able to expand the capacity to train more individuals, whether it be social workers, whether it be community health workers, whether it be primary care physicians. We look at how we can expand the capacity to train more of the workforce that we need. We also have programs to support individuals who want to pursue those health careers, and that's where our Golden State Social Opportunities Program fits right into that area. So we want to support individuals to be successful in pursuing these careers with financial support throughout your program, as well as to be able to support loan repayment afterwards while you're serving. And then finally, we recognize the need to really build the future workforce. We want to meet the gaps today, but we also need to reach into the next generation and support the next generation of our health workforce pipeline. So on the next slide, I wanted to just do a brief overview of the Golden State Social Opportunities Program. Again, a brand new program that we get to offer to be able to support students. On the next slide is just a quick overview. It's really about to increase the supply of the behavioral health workforce with an emphasis on clinical behavioral health practitioners. We'll talk about that in terms of getting support for receiving that licensure, and especially supporting those that are working in our nonprofit community-based organizations throughout California. We received funding of $8.8 million to fund individual scholarships of up to $50,000. And as Assemblymember Reyes talked about in terms of her priorities, the bill's priorities will be able to support applicants who have a history of involvement in foster care, who have a history of homelessness, or who are working at a community-based organization. So on the next slide, I want to turn it over to Ann Powell, our health program specialist with our program, to really start digging into more information about this program.
Thank you, Karen. I'm Ann Powell. I work in the policy section at Health Workforce Development. And next slide. And what I'm going to do is just a brief overview of the program. Based on the legislation, this focuses on 4 clinical professions: associate or licensed clinical social workers, associate or licensed marriage and family therapists, associate or licensed professional clinical counselors, and registered psychological associates or licensed clinical psychologists. Next slide. So awards will be based on this, how well each applicant fulfills all of the criteria for which their application will be scored. And the amount will be full, partial, or no, again, depending on those scores and the amount of funds available. Geographically, we strive to ensure distribution of our grantees across all of California. And awards will only be up to the total cost of attendance for up to 2 years of the program. Awardees are required to provide proof of registration with a clinical licensing board at the end of their education. And then within 6 months of graduation, awardees must begin serving 2 years of service obligation. Next slide. These are the key dates. So obviously we're in our webinar today. The applications are due August 15th. We anticipate announcing awards over the course of late summer, and early fall, depending on the number of applications we get and how long it takes to process them. And then final start dates of the grant agreements will be at the end of September. Next slide. With that, I will turn it over to my colleague, Christina Gonzalez.
Thank you, Ann. Hello, I am Christina Gonzalez. I am the Program Officer for the Golden State Social Opportunities Program. I'm going to highlight some key areas of the application process for you. If you could please go to the next slide. So the application has 9 sections. As you're filling out the application, once you complete a page, it is automatically saved. So if you need to stop and exit the application and return later, it will save your progress. The 2 key areas I wanted to highlight were the employment history. You may want to gather documentation or get the information ready with the names, dates, and places of your previous employment experience. And I also want to point to the required documents. You will be required to upload at least 2 documents to be eligible for this application. One is the cost of attendance, which you can obtain from your educational institution, from your financial aid office generally. That shows the cost of attendance. And the second would be the scholarship program verification form, which will you have completed by your program director or appropriate designee to verify that you are enrolled in the program. If you are currently working in behavioral health, or I think you will have to fill out an EVF, an employment verification form. And if you have in the past or are currently working for the state of California, you'll have to provide a conflict of interest letter. Those are the 4 documents you could have to upload, but you will definitely have to upload the cost of attendance and the scholarship program verification form. Can we go to the next slide? So this is regarding post-award and payment provisions. The most important part of the slide is regarding your address. The residential address that you provide must match what the IRS has on file, because when we send your checks out, if the address does not match, they will not be able to send your check. And also I want to emphasize that if you are not going to be able to complete your service obligation for any reason, that there are penalties for that you will have to pay the scholarship money back plus penalties. So it will be, so be sure that you're able to complete your service obligation before you take on sign up for the accept the award, basically. And so that is all I have for you right now. I'm going to pass it over to Kevin McEvely, who is the research data specialist.
Thanks, Christina. I'm in research and evaluation at the Healthcare Workforce Development. For this application, the evaluation and scoring procedures are the same as other scholarship applications at HCI. At the time of application closing, HCI will review each application for the presence or absence of required information in conformance with the submission requirements. We may reject applications that contain false or misleading information. And HCI will use the evaluation criteria described in the grant guide. Just want to add here that I think we will add to the chat the behavioral health programs page on the HCI website. Please keep an eye out there for any updates or addenda or notices concerning this program and its application. Next slide, please. So I don't know if anyone on the call was in the call earlier today about our other new program or has ever applied to another scholarship program at HCI, but the scoring criteria for this program are a little bit different. There are some items here that are on, there's some scored items that aren't on other applications, including the first, homeless and foster youth. This can score a maximum of 40 points, 20 points if the applicant is a current or former homeless youth, and 20 points if the applicant is a current or former foster youth. Also, the next item is a special item for this application if the applicant is an employee of a community-based organization. The next items are common with our other scholarship programs, namely languages spoken, 10 points if the applicant speaks any of the following languages listed fluently or well enough to be able to provide direct care services to clients. The languages listed, you'll find those languages on the application. It is the list of Medi-Cal threshold languages besides English. So the next item, medically underserved area, if the applicant has volunteered or worked in a medically underserved area or with medically underserved populations in the US or overseas. Economically disadvantaged, as defined by the Scholarship for Disadvantaged Students program, identified as having a disadvantaged background based on environmental and/or economic factors, or received a federal exception financial needs scholarship. And academic performance, if the applicant has a GPA of 3.0 or above, that's full points, and 5 points or partial score if the applicant has a GPA of 2.0 to just below 3.0 GPA for a maximum score of 95 points. And with that, I will pass it back to Chris.
Thank you to all our presenters. This team has worked really hard to put this program together. We're going to transition to our question and answer session now. We're taking questions through the chat feature only, as opposed to raising hands and enabling audio. This will make it easier for us to answer as many questions as possible in an orderly fashion. The chat option should be open now. And you can see at the top, we have pinned the link to the website where you can find the ability to apply for the scholarship program, and also you'll find the grant guide, and it's where we will be uploading the slide deck and the recording of this session. So go ahead and post any questions you have in chat, and we will begin to answer them as in the order that we get them. All right, Amber asks, is there an educational requirement or cap? Can you apply if you've attended college?
And you're muted.
This is not a loan repayment program. It is for currently enrolled students seeking a clinical degree.
If you've attended college but you're going back in, I think is.
If you could already have a bachelor or be in the early years of a PhD in psychology, and as long as you have 1 to 2 years of school left, although I will say this is intended to fund up to 2 years, so we encourage people who have 2 or more years to apply.
All right, thank you, Anne. Our university provides a cost of attendance document on this webpage. Is this what you are seeking? This is Carolyn.
Yes. So go ahead.
Okay. All right, thank you, Carolyn. All right, next question. If we just graduated this month with a master's in social work, are we eligible to apply for this program?
Only if you were going on for additional education in a clinical to be a clinician.
Anna asks, will this program also be offered in 2024?
It depends on how much of the funds remain after this first year of funding. So we'll see. We hope there will be money left for another cycle, but it depends on how successful we are this year.
All right, thank you. Stephanie asks, can you please explain the section about the points again?
Kevin?
Sure. So the section on points is also included in the grant guide, and we will publish this slide deck on the website in, I believe, 7 to 10 days. But what that is just for eligible applicants, the priority for funding will be based on the scores to that section. So if you are able to find in the grant guide what we pulled up on screen about the application scores, those are just questions that will be asked in the application and points that we will apply to some of the answers in there.
Thank you, Kevin. Stephanie asks, how far are you expected to travel or move for the employment portion?
We have no expectations that, we have no expectations that you'll relocate. It really depends on your decision of where you want to be employed post-graduation.
All right, Rochelle, excuse me, asks, is there an option to take longer than 2 years in employment?
It's a 2-year program. However, you may be in a 3 or 4 year educational program, and this would pay for 2 of those years. Up to 2 years.
And then for the service commitment, it's a 2-year service commitment, but after that.
So let's say I'm applying, I'm earning an MFT degree. I complete the program. It's a 2 or 3 year program, depending on the university. I would have 2 of those years potentially funded, up to $25,000 per year, which arrives at $50,000 of top amount. In addition, once you've completed your degree, which might be another year, you would begin a 2-year service obligation within 6 months of graduation.
And you can continue to work with that afterward. It's just the obligation is done at 2 years, correct?
Correct. Yes.
Okay.
We hope you will continue to serve the unserved populations. Yes.
All right, thank you, Anne. Rachel asks, can you clarify what constitutes an economically disadvantaged?
Kevin.
So the framing of the question is, as defined by the Scholarship for Disadvantaged Students program, identified as having a disadvantaged background based on environmental and/or economic factors, or received a federal exception financial needs scholarship. And there's a little extra information that is disadvantaged background as defined by the Scholarship for Disadvantaged Students program, Section 737 of the Public Health Services Act. This refers to individuals who have been identified by their schools as having come from a disadvantaged background based on environmental and/or economic factors. So this is just a self-reported yes or no question.
Okay, thank you, Kevin. Sylvia asks, just want to clarify the scholarship is available to students who are currently in MSW programs, but not currently working on their license, as that is only available to people who have completed an MSW.
So yes, for MSW students, as well as other clinical majors leading to licensure, but not for covering during their time earning clinical hours toward licensure. But one thing I'll just highlight here, this is a good opportunity to make this point, is that once you decide, once you've graduated, you have, we hope you will turn right around and once having made that decision that you're pursuing that clinical licensure, you can apply to the licensing board, you can register with them. And it's that step, that proof of having taken that final step that we need before you begin, or as you begin your service obligation. So you've done your education, you've completed your education, you've registered with the appropriate license board, and then you're doing your your service obligation hours.
All right. Ronnie asks, awardees may not have a concurrent employment / service obligation, correct? But can they receive other state awards that do not have an obligation?
What matters from our perspective, and maybe Clinton or Christina can jump in here as well, is that you can only receive funding from HCI a single award at a time. Do you want to, grants management, do you want to add more to that?
That's basically it. Just make sure you've completed your service obligations for any other awards before you start the service obligation for, or start. If you're in currently receiving an award, but your obligation ends before this program starts, then you can apply for our program and we can award you. It'll just need to start after your current award has ended, after your service obligation for any current award has ended.
Thank you.
All right, thank you, Christina. Gregory asks, the MFT program I am about to enter is 3 years long. If I apply this year, can I defer the scholarship payment until the second year, or would it be better to apply next year?
Your certainty of receiving funding would be to apply now, because we don't know if there'll be funds left over for next year. So you have to weigh the possibility that the funds will be fully expended this year or not.
Thank you. Lauren asks, are the scholarships awarded based on the order the applications they received? I don't have many points, 20. I will be more likely to be awarded a scholarship if I apply immediately. Will I be more likely to be awarded a scholarship if I apply immediately?
We can't say as to whether or not you would be awarded more likely if you applied immediately. But scoring will determine if you receive an award and the level of funding, regardless of when you apply.
All right, thank you, Ann. Susanna asks, so this is not for MFT or LPCC?
No, it is for those degrees and license categories as well. They are covered.
Aaron asks, where can we find a list of locations or institutions that qualify for this scholarship?
It's not an institutional award. This is an award to individuals. If you're asking which universities you need to be attending, when you make an application, you will have a drop-down list that will show you all the universities that are eligible for that you would be could be enrolled in to be eligible for this grant. Generally speaking, it's all public universities and all private nonprofit.
Faith asks, which doctorate programs are eligible for the scholarship?
Clinical psychology. So that would be a PhD or a PsyD.
Thank you, Ann. Diana asks, if I'm not enrolled into a program but will be applying next year, will I be eligible?
It will depend on if funding is still available and what your and the conditions of your application in terms of scoring criteria and other factors.
All right. And for everyone watching today, we did just post the grant guide to the chat, and so you can reference that as well as we go through all of this. All right, Rachel asks, what is the difference between this program and the Behavioral Health Scholarship Program? And is it possible to apply for both?
You may apply for both. You will receive funding from only one of the programs. The significant difference is that this program provides up to 2 years of support, up to 25,000 each of 2 years. And regardless, in this program, regardless if you only get 1 year of support or 2, you still have 2 years of service obligation. So that's something you have to weigh when you decide to apply for this program. So if you know you're only in school for 1 year, consider that when you choose which program you're going to apply for. And the list of universities is unique to the Golden State Social Opportunity Program as a condition of the legislation that enacted the program.
All right. What are the minimum number of points you need to qualify for this scholarship?
There is no minimum. It's ranked, and we will decide based on how many applications, and the level of funding requested overall, along with how scores fall on a continuum. So there is no minimum.
Sylvia asks, another point of clarification, if a person has completed an MSW and is currently working and also engaged in doing the supervision hours for getting licensed as an LCSW, are they eligible?
I'm sorry to say you're not.
Next question. So if we only have 1 year of school left, will we only receive the scholarship for 1 year?
Correct. Yes.
Next question, is this a full-time 40-hour per week program?
We require a minimum of 6 credits per semester or quarter. In the application, you'll see that you'll be asked how many units of credit you're earning at the time that you apply. In terms of the other thing where you might be inquiring is that we do require that the service obligation be on a full-time basis, and it being providing direct services to clients.
Next question, if you only receive the scholarship for 1 year, do you only work for 1 year after that instead of 2? I believe you answered this already, Anne. It's the 2 years regardless, correct?
Yes, it is a 2-year obligation regardless.
What happens if there is no employment available that meets your requirements for the service obligation?
Our grants management team will work with you to sort that out. We do ask that people find employment within 6 months, given the status of the urgent need for services in the community. We are optimistic about your opportunity to find employment.
All right, Karina asks, if we receive the university grant, will this scholarship also take that into consideration, or will the scholarship still send the amount it costs to attend?
It will be based on the amount of costs you have, the amount of your education. Yes. Actually, I'd like Clinton to weigh in here if he could, or Christina. Do you have an opinion about how much, if there's a university grant, like Clinton?
Hi, folks. My name is Clinton Ramstead. I'm one of the program managers here. I wanted to ask for a clarification on that. Are you asking how much debt there is, and like if we were to pay the difference, or are you asking to go above and beyond that?
So let's assume it's the former that they're asking. Do we pay just what remains of their student costs, or do we pay regardless of their loan, of their grant from the university? I'm trying to think of how the application is worded, and I think what you're going to do is get the cost of your education from your university, right?
Yeah, I
Karina
believe it's the case.
answered correct as far as the scenario.
So maybe the thing to do would be to ask Karina if I'm saying your name right. I hope I'm saying it right, Karina. If you could email us at the BH programs email address you'll see at the end of these slides. with your question, and we'll follow back up with you.
Yeah, that might require a little follow-up. I'm hesitant to
Yeah.
answer without knowing more.
Yeah, that's what I'm thinking too. Thank
Okay.
you.
Thank you, Karina. We'll get that answered for you. Sylvia, if a student is receiving funding through the CalSWEC program, can they still receive the HCI funding?
It depends on which CalSWEC program you're receiving funding from. If it's the clinical track for behavioral health clinicians at CalSWEC, then no, you would not be eligible because HCI is funding that program. However, if it's Title IV-E, that's federal money, so you would be eligible.
Jade asks, will these slides be available after this meeting? Jade, yes, we will be posting these slides on the website. Additionally, we will be emailing out everybody a copy of this webinar once we have it transcribed and uploaded. It usually takes about 7 to 10 days, so everyone will receive an email with that information as well. All right. Cheryl asks, where can I get the scholarship program verification form for my graduate program? Is it possible to get the form from my graduate program website?
It is something that you get from your university, yes.
Tiffany asks, are you aided in finding a job post-graduation as well to serve the 2 years where you are living, or do you find the job on your own?
We do not assist with employment finding.
Your school may have something to help with that, but we do not.
Definitely. That's a good idea, Chris.
Yeah. Lauren asks, can you tell us a little more about the service requirement? I live in a small mountain community. My community is medically underserved, but we also don't have many organizations providing services. I am concerned about getting into a situation where I can't find a position at a qualifying work site near me, and I either have to take to pay steep penalties for defaulting on the agreement or spend 2 years commuting to an unreasonable distance to a qualifying site. Can you speak to this situation?
We appreciate your situation. I think the challenge is that we want to support people in rural communities, as you're describing yourself, to your circumstances, and we recognize that applicants need to plan on hopefully will pursue a career serving underserved populations. But our grants management team will work with you in terms of how we figure out the worksite issue. But do take into consideration, if you do not believe that there is a worksite in your community that could employ you during your work, your service obligation, that's something you need to give serious consideration to.
Thank you, Ann. Stephanie asks, what's an example of an underserved area or population? How can I find out if my current job is a part of that?
So traditionally, we think of people who are linguistically and culturally underserved. Also communities with high rates of Medi-Cal and uninsured communities. And racial and ethnic minorities tend to be underserved as well. I don't know, other than we have a complicated way you could see if you are in a health service area, but I don't want to subject you to that process. It's really hard to use for the average person. So it's a self-attestation as well on your application.
Would, if they have further questions, should they email?
That's a good idea. Yes.
Yeah, Stephanie, go ahead and email us if you have a specific situation that you're unable to determine, and we can help you out. Yvette asks, does being placed in the care of relatives without going to a formal court procedure qualify as foster or homeless youth, but through the Department of Child and Family Services, and do you have to provide documentation?
So we do not require documentation, and relative placement is considered out-of-home care for purposes of the foster youth. So you could, if you're in the foster care or child welfare system broadly, and in out-of-home care, that's what matters. And you do not need to provide documentation.
Does working for the county count towards your service obligation?
Yes, it can. Yes. But again, the clock starts 6 months or excuse me, as soon as you graduate. That's when the clock starts. So if you're currently working for a county agency and you're continuing to work there after you complete your clinical graduate degree, then yes, the clock would start and you would earn your hours toward your service obligation. I think we skipped a question.
I was one we had answered before.
Okay, just checking.
Yeah, if there's, yeah. The 2-year requirement, the 2-year obligation remains no matter how many years of school you get.
Right.
Yep. All right, if applications are accepted to my MSW program in November, should I find a program that starts sooner?
You would not be eligible if you wait until a November admission. So, and again, it's when you actually enroll in graduate school. So, given that we're into late May, the last day of May, by now you should know whether or not you're going to be enrolled. So, you need to be able to provide verification form to the university that you are enrolled.
All right. I'm currently enrolled part-time, but will be enrolled full-time starting this September. Can I put my fall 2023 units on the application?
As long as it's 6 or more units, that's what matters. That's the threshold for eligibility.
Does the 2-year obligation start upon graduation with a master's degree or upon receipt of the license?
Upon graduation from graduate school, for receipt of the master's degree.
Right. What happens if I cannot immediately secure employment with an agency within 6 months?
Again, I think we've addressed this, but basically, we will attempt to work with you around that issue. And that need not be a nonprofit agency, it could also be a county agency.
If a student from California accepts an internship placement outside of California, are they no longer eligible? Conversely, can a student moving to California for an internship receive support?
Well, it's a 2-part question. So we're looking for increasing the supply of behavioral health clinicians in California. And our experience typically is that people practice where they have done their graduate work. So it really depends on your circumstance and whether or not you're a resident of California. And with regard to the second part of your question about moving to California, you would need to be a resident at the time of enrollment. At the time of applying for this program.
Kayla asks, if we apply for both grants, do we get to choose which one we can accept, or will one be chosen for us?
I would defer to Clinton and Christina on that one. I don't know that process.
You can choose. You can choose.
Thank you, Christina.
All right. Amber says, I have an MA in criminal justice and I am wanting to return to school for my MSW. This would qualify for the grant, correct? I am currently employed as an administrator for FFA. This would be considered a CBO, correct?
That is, so on both counts, correct. You would be eligible. What matters is that you're enrolled at the time you return, by September when the grants are awarded. And yes, an FFA happens to be I don't know of any who are not CBOs. And for the audience, FFA is foster family agencies who do placements of children in the child welfare system.
All right, thank you, Ann. Raphael asks, would program management within a CBO count as direct services?
Only if you're directly supervising individuals who are providing clinical services to clients. General program management would not qualify.
Stephanie asks, is it a 2-year requirement for any agency? What if I start working for a mental health agency, but decide to take a job somewhere else?
The 2-year obligation can be with one or more agencies. What really matters is that you're going to be asked to provide documentation of that over the course of time as proof that you have completed your 2-year service obligation.
Janine asks, are students enrolled in graduate programs to become a physician assistant or a doctor of physical therapy eligible to apply?
No, they are not.
JR asks, does employment with a local county government agency qualify for employment for the service obligation? I think we answered that as yes.
Yes.
All right.
What matters, though, I'll mention, is that you're doing direct services in your service obligation. Either direct services or supervising individuals doing direct services, providing direct services, I should say.
All right, thank you, Ann. Ronnie asks, Title IV-E has an employment obligation. Is it still okay?
It does, but your service obligations run consecutively. I'll get the word out. So if you have a 2-year obligation with Title IV-E, let me just say this. Why don't you email us that question? Because I don't want to say for absolute sure certainty without the team discussing it further.
Okay, yeah, Ronnie, please email us and we'll look into the specifics of that in more detail
Perfect.
with you.
Yeah.
Julie asks, if we already work at a qualifying CBO, can we continue with that organization for our service requirement? How do we find out if our CBO qualifies?
Yes, you can continue to work there. The clock starts for your service obligation upon graduation. So definitely that's appropriate. And we have no qualifications for CBOs. What matters is that it's a community-based organization. And because you're working in a community-based organization already, you get additional points in your scoring.
All right, excellent, thank you. Michaela, it sounds like more of a comment, but it could be a question. There could be a remote job opportunity for those of you who live in rural communities.
That could be. We don't know.
Okay. Would a family resource center qualify as a CBO?
So I believe so, but check with your employer as to their tax status. A CBO is the same as having a 501c3 federal tax designation.
And just a reminder, bhprograms@hchi.ca.gov is the email address for those that need to email us with to get more details. Stephanie asks, what do you need for my MSW program to verify that I am enrolled and starting in August?
Christina, do you address this?
Yes, that is the scholarship That is a form that you will download from the application itself. That is the scholarship program verification form.
All right, thank you, Christina.
Mhm.
Jamie asks, how likely is it that someone gets awarded assuming they meet all of the qualifications and meet deadlines?
It's impossible to say because this is the first time we've offered this program.
For the service requirement, are there exceptions to the maximum time off allowed for things like family leave?
Yes.
Go.
Yeah.
Thank you.
Yes,
Jump
we
in
will
there.
have to, if you take off more time than the maximum, then we'll extend the end of your contract to cover the time that you missed.
Okay,
Perfect.
thank you. Julie asks, wanting to clarify, managing positions need to be managing those providing direct clinical services like caseworkers and social workers, not managing general service providers that isn't clinical.
That's correct. You're stating it correctly. Management is of direct clinical services.
Okay. Dina asks, does a counseling psychology master's program that begins in the fall eligible?
Yes, it is. Let me clarify that usually counseling and psychology is leading to an LPCC or an MFT. If I'm wrong, please email us to say you're looking for a different degree. But as long as what you complete your education with sets you up to become licensed as an MFT, professional clinical counselor, or a clinical social worker, or a psychologist, clinical psychologist, then yes, it's covered.
All right. Amber asks, if fall semester starts in August, we would need to pay upfront tuition until we receive our funding from the grant, correct? Assuming
That
we're
is
granted a
correct.
scholarship.
Yes, that is correct.
Kayla asks, is a local hospital considered a CBO? I believe they are a nonprofit, so it sounds like yes.
Again, check with your employer as to their tax status. Many hospitals are nonprofits and some are also profit.
Right. Let's see. JR asks, if we haven't been in foster care ourselves, but work directly with foster care and adopted children with special needs, does that score any additional points?
Sorry, it does not.
All right. We're uncertain of remote job opportunities, but they may be out there, Tiffany. Let's see.
I think answered that.
Yep. I can't stay for the entire webinar. We will be emailing this to everyone who's registered. You will receive both. Well, you receive the link that will take you to the recording, and we'll also have the slide presentation linked as well. So, all right, that looks like the end of the questions so far. Do we have any other questions remaining? Give people a few seconds here to think of any other questions they want to ask. All right. If you do have other questions, you can go ahead and email the team again at bhprograms@hchi.ca.gov. Thank you all for your participation in the Q&A session. Those were great questions. And as a reminder, we will post the recording of this webinar on our website in approximately 7 to 10 business days, and we will be emailing that out to you. And with that, I'm going to hand it back to Karen Rizel, Deputy Director with Health Workforce Development, for some closing remarks.
Thank you very much, team, for the presentation, and thank you so much for all of you who are here today learning about this program, the Golden State Social Opportunities Program, a new program for us, and all of your questions. We really appreciate your interest to this program. If I could go to the next slide. As was mentioned, we want to make sure that we stay in communication with you if you have any questions. You can also follow us to find out information about all of the other programs that we may offer that may be of interest to you. And so we encourage you to do that. And then on the next slide, as was mentioned, is again some additional opportunities to contact us with any questions. Also to subscribe to our mailing list. If you would like to receive our monthly update of all of our programs, we encourage you to sign up for that. To learn about the things that we're doing, give us a call or email us. But just thank you so much for your attendance here today. We hope that that you take the time to apply and also let others know about this program. We will be posting, as was mentioned, our grant guide is on the website now. It has all of the details and more that from what we discussed today. We encourage you to stay to read that, and if there's any addenda or changes to that, those are always posted to our website. So we encourage you to bookmark that link for as you potentially pursue applying, and we look forward to seeing your application. Thank you so much for everyone's time today, and that will conclude our webinar.